So the health gap that exists for our community, the First Nations community, sees that our families will die 10 years earlier than anyone else. This for me is extremely confronting, especially as I sit amongst my community who experience chronic disease. I now have the opportunity here with the Birthing in Our Community program to completely change that, to focus on prevention and to help our families carry their baby for as long as they possibly can so that child can be strong and healthy and enter the world like everybody else and have the same health equity that any other person has the human right to access, to have, to hold.
When you go mainstream, it's like there's a long waiting list for mothers and you have to wait and wait and wait. But these guys here, you know, especially being an Indigenous clinic, it's just, they just get things going straight away.
The BIOC program is so important to our women in the community, particularly if they're birthing within an institutional setting. You know, the hospitals aren't, you know, really seen as a safe space. So the hub here is you know, a safe space for our women to come and have their care and really have that family feel.
The Institute for Urban Indigenous Health is a regional health organisation. Our vision at IUI is strong, vibrant, healthy individuals, families and communities. Census data has been an important part of the growth and journey of IUI. Really did tell the story and provide us the insight and understanding that there was a huge job to be done in terms of meeting the needs of our people. Data generally has been a huge pillar and foundation upon the work of the network and all of our member services.
It's incredibly powerful to build mum's capacity to be the best parent she can be. So here at the Hub, we not only have our midwives and our incredible family support workers, but we also offer transport.
If our mums didn't have access to transport, they would find it difficult getting to their appointments, and those appointments are very important for them for the milestones throughout their pregnancies, and not only for the baby but for their mums.
I really was somebody who just want like a house mouse. I'd just stay in the house and just didn't want to associate with anybody, but now being here I'm very social, out of my shell.
Thanks to the Birthing in Our Community program, one of the great outcomes has been that we have seen a 50% drop in preterm birth weights. What that means is that our families are holding their babies longer and birthing babies closer to the 40-week mark. This means that baby is born stronger and therefore less likely to experience chronic disease later in life.
Definitely when you're working with, I guess, your own people, it's just like home, I guess. You're like family helping family, so yeah.
We are here, we are strong, and it is about seeing the resilience that sits within and working to that strength.